Welcome class, to today's lecture on drug-induced liver injury. In this session, we will delve into the mechanisms underlying this condition, the various diagnostic methods used, common medications associated, and the distinguishing features of acute versus chronic liver injury. Furthermore, we will explore the immunological-based reactions, risk factors and predisposition for development, diagnostic evaluation, histopathology and liver biopsy findings, non-invasive diagnostic modalities, management considerations, liver transplantation, prognosis, and long-term outcomes. So let's begin our exploration of drug-induced liver injury. Drug-induced liver injury can occur through direct toxicity, immune-mediated reactions, and metabolic activation. These mechanisms can result in hepatocyte damage, inflammation, and liver failure, caused by oxidative stress, disrupted bile flow, aberrant immune response, and bioactivation of drugs by cytochrome P450 enzymes. Accurate assessment and monitoring are essential in detecting and managing drug-induced liver injury. Laboratory tests play a vital role in this process, including liver function tests such as alanine aminotransferase, ALT, aspartate aminotransferase, AST, alkaline phosphatase, ALP, and bilirubin levels. Imaging modalities like ultrasound, computed tomography, CT, and magnetic resonance imaging, MRI, can help evaluate liver morphology and identify specific lesions or abnormalities. Clinical assessments, including physical examination findings, are also crucial in evaluating patients for signs of hepatotoxicity. Several medications have been implicated in drug-induced liver injury. These include acetaminophen, nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, and certain antibiotics such as amoxicillin clavulanate. Understanding the mechanisms of action and potential hepatotoxic effects of these medications is crucial in their safe and judicious use. For example, acetaminophen overdose can cause hepatocyte necrosis due to the accumulation of its toxic metabolite, N-acetyl P-benzoquinone imine, NIPK, while NSAIDs can lead to liver injury through their impact on prostaglandin synthesis. Differentiating between acute and chronic drug-induced liver injury is crucial for appropriate management and prognostication. Acute liver injury typically presents with a sudden onset of symptoms, including jaundice, fatigue, and abdominal pain. Histologically, it is characterized by centrilobular hepatocellular necrosis and inflammation. On the other hand, chronic liver injury presents with a gradual onset and may manifest as fibrosis, cirrhosis, or hepatocellular carcinoma over time. Understanding these differences allows for tailored therapeutic interventions and long-term follow-up. Idiosyncratic drug-induced liver injury is characterized by an unpredictable and dose-independent response to a medication, presenting with various clinical phenotypes. Hypersensitivity reactions, a subset of idiosyncratic reactions, involve an immune response to the drug or its metabolites, resulting in liver injury. These reactions can manifest as hepatocellular, cholestatic, or mixed patterns of injury. Clinically, idiosyncratic reactions can present with vague symptoms, making diagnosis challenging. Immunological testing and exclusion of other potential causes of liver injury help in identifying these reactions. Certain factors increase the susceptibility to drug-induced liver injury. Host-related factors include genetic polymorphisms in drug-metabolizing enzymes, transporters, or human leukocyte antigen, HLA, molecules, which influence drug metabolism and immune response. Pre-existing liver disease, such as chronic viral hepatitis or non-alcoholic fatty liver disease, predisposes individuals to heightened vulnerability. Drug-related factors include drug-drug interactions, as some medications can potentiate hepatotoxicity when co-administered with other drugs. Understanding these risk factors aids in predicting and preventing drug-induced liver injury. Accurate diagnosis of drug-induced liver injury requires a comprehensive approach. It begins with a detailed history taking, focusing on medication exposure, including prescribed drugs, over-the-counter medications, and herbal supplements. Physical examination findings, such as jaundice, hepatomegaly, or ascites, can provide important clues. Laboratory investigations, including liver function tests and specific biomarkers, help assess liver injury and exclude other causes. Imaging studies like ultrasound or MRI aid in evaluating liver structure and ruling out other liver diseases that may mimic drug-induced liver injury. Liver biopsy plays a crucial role in diagnosing drug-induced liver injury. Histopathological examination allows for the identification of characteristic features, such as hepatocyte necrosis, inflammation, and presence of eosinophils or granulomas. These findings help differentiate drug-induced liver injury from other liver diseases, as well as provide insights into the severity and prognosis. Importantly, liver biopsy can help exclude competing diagnoses, allowing for targeted therapeutic interventions. Advancements in non-invasive techniques have improved the assessment of drug-induced liver injury. Imaging can measure liver stiffness, an indicator of fibrosis, while serum biomarkers help differentiate liver injury causes. These techniques are accessible, easy, and safer than liver biopsy, but their accuracy varies. Timely discontinuation of the implicated drug is vital for managing drug-induced liver injury. Supportive care involves monitoring liver function, providing nutrition, and addressing complications. Tailored management based on the specific type of injury maximizes outcomes and prevents progression. Liver transplantation may be an option for severe drug-induced liver injury cases, especially when there is irreversible liver damage, systemic complications, or poor prognosis despite aggressive treatment. However, deciding if and when to transplant is challenging due to unpredictable outcomes and individual variability. The prognosis and long-term outcomes of drug-induced liver injury depend on various factors. The severity of liver injury, including the extent of hepatocellular necrosis or fibrosis, has a significant impact on outcomes. Older age, pre-existing liver disease, or coexisting comorbidities can worsen prognosis. Additionally, the duration of exposure to the offending agent affects recovery, with shorter duration often associated with better outcomes. Timely cessation of the causative medication and appropriate management are crucial in achieving favorable long-term outcomes for patients with drug-induced liver injury. Drug-induced liver injury is a complex challenge in clinical practice. Advances in diagnosis and treatment have improved outcomes, but further research is needed. Gastroenterologists must stay informed to provide safe and effective care for these patients.